It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, thanks for joining us. I'm going to keep you healthy, folks. We're going to keep you healthy. Before I start the show, I want to tell you a story. My wife and I were at a supermarket, and this middle-aged lady came up to us with her husband, and she said, "Mr. Lesante, I don't mean to bother you, but I want to thank you very much for having the health shows that you have, particularly with when you bring the doctors on from the Lehigh Valley Health Network." And I said, "Why?" He said, "Well, look at this guy." She pointed at her husband. And he says, "My husband never was going to the doctor, never did this, never did that." And I said, "Well," I know how that feels. I'm a big baby. However, I do get my checkups. And we were watching one of the shows with one of the doctors, and they were talking about a certain thing and why it was important for them to get checked. And so I nagged my husband, "Please go and see him." Long story short, she went to the doctor, and if it wasn't the fact that we had the show, the doctor said it was almost in a situation where it would be very difficult for you to make it. And so those are the kind of shows that I really appreciate. Now, I told you many times, folks, you're looking at the biggest baby in town right here. I look at a doctor and I get my blood pressure goes up. However, that's important to take care of yourselves. Now, today I have two doctors on that everyone in this area knows, good friends of mine. And believe me, not because they're friends of mine, they're very knowledgeable and been doing a great job, and that's Dr. Edward Polashenski and Dr. Robert Yamulla. Gentlemen, it's nice to have the both of you on.
Pleasure to be here.
I tell you I was late this morning because I had surgery this morning at 6 o'clock and I had another, so I was really tied up.
We know that.
Yeah, and so I don't want to take your job, but I want, but
please take my job.
It's nice to see the both of you. And it's funny because you were just telling me that, that even though you guys work together, you don't see each other, as much as people think.
All the time.
Yeah. So every 2 weeks you bump into say, "Hey, I know you, right? We work
exactly.
together."
Yeah, the divide and conquer.
Yeah, that's right. That's right. We're going to talk about gastroenterology, okay? Now, I want you to know that there's been changes made, and we'll talk about some changes, good changes. But, Dr. Polashenski, a lot of people know of you, but tell me a little bit about yourself.
Well, I've been back in Hazleton. In June, it'll be 40 years practicing in Hazleton. This is my home. I'm third generation in this area. And truly, it's been my pleasure and my honor to be back here in my hometown for these years. The people have been wonderful to me, and I think we've done some good. And I'm very happy that you've allowed me to come on the show and just talk about gastroenterology because of the changes that are happening.
Did you, when you graduated, did you want to go into this field in the gastroenterology?
I always wanted to be a dermatologist.
Oh, okay.
But dermatology fellowships were very difficult to get. And I tried, and I was in at Geisinger, but then the chief of my department said, "Ed, why don't you do gastroenterology with me?" He was a gastroenterologist. So I said, "All right, well, let me try that." Well, as soon as I picked up the scope and I started doing the procedures, I knew that's what I was meant to do. Mm-hmm. It was just an extension of me to do this endoscopic surgery. I just felt very comfortable with it from the very beginning, and that's how I started.
You stay with it. And how long have you been with in the Hazleton area?
40 years.
40 years. So you went through St. Joseph's and the whole...
Yeah, I started in St. Joe's ambulatory. I was one of the ambulatory physicians while I was still doing my training. I would come up on weekends and work there, and it was great. I loved it. I made some money. You don't get paid much as a resident. Yeah. So, I've been here all this time, and it's been very good. Yeah.
You like the merger, the relationship between the hospital now and Lehigh Valley?
Absolutely. To me, it's been a big advantage. Again, they handle all of the nuts and bolts of running a practice for me. I can just concentrate on doing medicine.
Which is the way it should be.
Which I love, yes.
And is your mom or dad in medicine?
Nope. I'm the only one in my whole family. And now I have 3 sons who are all engineers, not doctors. Right? Yes.
What happened?
They were smart. Actually, they have very good jobs in engineering, so they did the right thing.
That's terrific. And of course, Robert, we all know your dad. He was way ahead of his time when it came to breast cancer.
He really was.
I had many, many great interviews with him. But he would tell me, like we did the show now, he would say, okay, now Sam, you got to come up to St. Joe's, okay? We're talking BR1 and BR2 at the time of cancer. He gave me an education for 2 hours, Bob, and you got to know all this stuff before we do the show. You have to know everything. He was very thorough. And when I say he was ahead of his time, man was ahead of his time in terms.
He took Hazleton from modified radicals to breast preservation with lumpectomies and sentinel node. He brought all that here. It was just something he got an interest in, and he went to these places and learned from these people and brought it here. He was the one who brought it here.
He had a passion for it, Bob.
He had passion for it.
He had a passion for it. I mean,
that
this
was
guy,
his thing.
Yeah.
When he first came to town, he was telling me stories in the 50s, ladies would be so embarrassed to talk about it, but that when they came to him, they'd have these horrible masses on their chest that were way beyond what he'd treat. And that's what he walked into in the late 50s in this town, and brought it to where modern breast preservation is today. He the one that brought it to that.
I have to go back and really have to research some of the shows we did with him, because it's the information that he had and what he brought to the table was fantastic. Yeah. And so why did you then go into gastroenterology?
Why did I go into surgery?
Yeah, not into being gastroenterology.
Why did I go into gastroenterology?
Yeah.
I started, I was going to be an intern, like that. You all start with something else. I was going to be a general internist, and I was chief resident where I was. And at the time, we had a very, very good GI, Herman Arbach, who was the ultimate jack of all trades. Yes. He was our cardiologist, and head of anesthesia, GI, internist, and Herman did them all well. He was a really great physician and served this area so well. And he was getting older and getting ready to retire, and really started as a question. Well, what do I? If there's no GI people here, should I rely more on X-ray? Should I refer him? What should I do? And they said, well, if you stay another year, why don't you stay and do a fellowship? And I really didn't think. I started doing that, and like Ed, it was something I really enjoyed, and that's how I got into it.
How long have you been doing this, Bob?
I came in '87, so about 30, so whatever, 30.
So you know a little bit about it, right?
A little bit. We've been here since '87. I was here since July of '87 doing this.
So between the both of you have a little bit of knowledge of gastroenterology, right?
We have a bit of experience.
He's my right hand. When I don't know what to do, he tells me.
And I'm the same.
I find that hard to believe.
We're two heads are always better than one
Yes,
many
it
times.
is.
So these tough ones.
When you're talking about, getting a colonoscopy, there's different screenings now, right? Okay, so share that with me and the audience. What are the different screenings that are available?
There are multiple ways to get your colon checked. Colonoscopy is still the gold standard, okay? But because of some apprehension or some medical problems that prohibit you from having a colonoscopy, there are now stool tests that check for abnormal DNA in the stool. And these are advertised on television. You can see that. And so you can do the stool test to tell you whether you have polyps or cancer. But the problem is, when the stool test is positive, you need a colonoscopy. Yeah. So it still comes back to the gold standard. You can have a short scope, a proctosigmoidoscopic examination more often, and hemocult or stool tests for blood, that's another alternative. Or you can have a barium enema, which is an X-ray test where they put barium in the colon and take pictures. But if it's positive, you need a colonoscopy. Mm-hmm. And also, finally, there's a CAT scan examination called CAT scan enterography, where they can do a CAT scan examination of your colon looking for polyps or cancers. But again, if it's positive, you need a colonoscopy.
Mm-hmm. So what are some of the symptoms, or when do you think a person should be looking at either getting this? I mean, the stool sample seems to be the easiest way so far. I mean, for people who fear it, I don't know.
Well, again, understand that those are national guidelines. So, well, why would they have all those different things? Because some places in the country don't have people who do endoscopies. That's so. Right. The other tests are better than nothing. Mm-hmm. And people, again, or somebody who's fearful says, I won't do a colonoscopy no matter what, those tests are better. They save lives. So they're certainly better than doing nothing. And I'm sorry, get back to your question.
Well,
I apologize.
The question was that, what were like some of the symptoms that, a person would be thinking about that they should have a colonoscopy?
We don't want to wait for symptoms. The best symptoms for early are no symptoms. Colon cancer is very asymptomatic, meaning there's no symptoms until it's pretty far along. Right. And before that, the nice thing about endoscopy is most screening tests, mammography and things like PSAs for prostates, are screening tests, meaning they're trying to get early cancer detection. But the nice thing with the colonoscopy, it's both screening, early detection of cancer, but also prevention, in that people with polyps, these little tiny warty growths, and most are harmless. Most, 1 in 100 though, can become a colon cancer. And we believe that if we remove those polyps, we lower your risk of colon cancer. And so far, the data from the past 30 years suggests that we're right. It's not just a good idea. It appears that we're right. So we can use colonoscopy both as a screening test for early detection, like a mammogram, but we also can use it as preventative if we can remove polyps that haven't had a chance to become a cancer yet. They're gone. They've never had a chance to become a colon cancer.
That's a cancer that's not going to happen.
Yeah, so we can prevent the cancer. That's the nice thing about colon. It's both a screening test and a preventive test.
Okay, so why, I've had them. In fact, I'm scheduled. I'll be calling you soon because I think every 5 or 6 years. How many years do you have to wait before you get another one?
Depends what you find.
Yeah.
So the guidelines now, if there's nothing and you're not worried about the family history, or there's nothing about the exam you're worried about, they say 10.
Yeah. Okay. I'm in good shape.
If you've had a lot of polyps, depending on what polyps you have, how many, what size, you come back sooner. It depends.
Do you remember I don't know, Bob, if you were on the show, but I remember, my wife was an RN. Go for colonoscopy. Go for colonoscopy. I'm nervous. I'm afraid. Blah blah blah. I was a nervous wreck.
Yes.
And I went for you performed the colonoscopy, and the test or the prep is piece of cake. Mm-hmm. It was a piece of cake. Yes. I mean, it was like, wow, what was I all nervous about it?
Yes.
So
especially with modern anesthesia, it's much easier.
Is it really?
Yeah, with modern anesthesia.
Is that right?
Yes.
What is it like?
The new anesthetics that they're using are very short acting and very safe, so that you think you blinked your eyes and the test is over.
Someone say it's the best sleep they ever had.
Best sleep you ever had. Yes.
Yeah. Could you send that home because I could use it at night?
No six packs.
No six packs. So I mean, so is there? I know there's been a lot of advances throughout the years. What are some of the new things in doing colonoscopies that have happened?
Well, one of the most important things I wanted to relate to everybody is that the age for your colonoscopy now by the American Cancer Society has been changed from, well, it's always 50 years old you should get your first colonoscopy. Well, we're seeing colon cancer now in younger and younger people, which is a big change. So they've changed the age to 45 rather than 50. And in my opinion, I think it's going to go lower than that in the near future, because we're seeing cancer now in late 30-year-old people.
Of neoplastic polyps, benign, but in young people,
yes.
In 30s. I've had some in the 20s, since I'm shocked that shouldn't happen, but it does happen.
Is it due to diet? Is it due to? I mean, is it?
We don't know.
You have no idea.
We don't know. I am suspicious it's due to diet and processed foods that we're eating, but it has not yet been proven. But it is very worrisome to us. And you talked about symptoms. If people do present with symptoms, even at age 30, we tell them, get a test done.
Yeah.
Because we're finding colon cancer in young people.
Yeah. So a person in the mid-30s or whatever should really at least consider maybe doing somewhat of the screenings, whether it's the blood, stool sample or something, okay, other than doing the colon. But the colonoscopy is they have different preps now. Do they do different preps?
We have multiple preps that we can use.
And nicer are these lower volume preps now. Instead of drinking an entire gallon, there's actually the volume has become less.
Just
you come out with it now. When I had a drink, I mean, I thought I was drinking half of the Susquehanna.
That's
what
right.
I mean? Folks, I'm talking to Doctors Polashenski and Dr. Yamulla. We're going to come back, talk a little bit more about this. I know prevention is always the best, I'm telling you. And if I could do it, anyone in this world could do it. We'll be back right after this. Thanks for staying with us, folks. Remember, 24/7, you can watch all the programs we produce, all the neighborhood programs on ssptv.com. And for those of you who do not have cable, you can go to YouTube. YouTube is just subscribe, SSP TV, and there's no charge, of course. And also translation for those into Spanish, if you can't understand English that well, we have as much information for you as possible. Today, we have two doctors that are no strangers at the Northeastern Pennsylvania, Doctors Polashenski and Yamulla. They are gastroenterologists, and we're talking about the procedure. Okay, let's talk about the safety of procedure. We're talking about anesthesiology and what you're getting, but how safe is the procedure, Ed?
I think we have an extremely safe atmosphere for doing the colonoscopies. We have board-certified anesthesiologists who are there to assist us with the sedation for patients. It's a fully equipped surgical center. We have all of the state-of-the-art equipment to handle any emergency that would come up, okay? Bob and I have been doing this for a long time, so that we feel very confident in what we're doing. Of course, anybody can have an unforeseen complication, but I feel we can handle anything that comes up at the surgical center.
So you're prepared in case something at the wellness center, because
Yes.
we're not okay. You're all prepared in case anything should happen.
Yes, and I'm confident of that.
Okay. What now? You've changed, right? You're not. Where are you performing the colonoscopies?
This, now we're at the Wellness Center. They have this wonderful dedicated department. We have much more room. We have a wonderful staff, and we have the brand latest state-of-the-art equipment, which I think is really nice.
When we're talking about advances, all right, and you have a full crew, all right. In terms of why again, you're saying now that between 35, even 40, you should definitely get a colonoscopy or get some kind of screening.
Well, the recommendation now from the American Cancer Society is 45, and that's what we're using as the gold standard rate now. In my opinion, I think it will probably become younger than that as this trend were to continue about younger people getting colon cancer. But at this point, we're saying 45, you should get your first colonoscopy. Now, if you have symptoms, okay, change in bowel habits, blood in the stool, abdominal pain that doesn't want to go away, unexplained weight loss, those are all things you need to talk to your doctor about and perhaps get a test done sooner. If you've had a family member who's had colon cancer, you should get a colonoscopy done 5 years younger when they got their cancer. For example, if your parent got a cancer at age 50, you should definitely get it at 45. Or if they got a cancer at 45, you should get it done at 40. Mm-hmm. If you have certain family history, if you're diabetic, if you're certain ethnic groups, African American people have a higher incidence. Eastern European Jews have a higher incidence of colon cancer. So there's many factors that Bob and I look at when we're talking to people.
So that's interesting, because I asked you before about what would be diets or whatever.
Yes.
But yet when you're saying African Americans, why is that? And when you're saying Eastern Jews, why is that? Is it
Probably genetic.
Is that right?
Yes. Mm-hmm. Yes.
So a lot of that could come from genetic.
Yes.
It's surprising to me that they'll tell you about smoking, about cancer, and and all the other things that you shouldn't be doing. But it's surprising to me that yet we don't have or maybe we do, a list saying that these are the things that you should be careful of that potentially can cause polyps or whatever. I don't know. I mean, is that?
Yes, that's true. That's true. Yes. We find a higher incidence in people who eat a lot of red meat or processed meat, like hot dogs or bacon or smoked. A lot. Yeah. Smoked foods. People who are diabetic have a higher incidence of colon cancer. People who are obese have a higher incidence of colon cancer. People who have a very sedentary lifestyle, they don't exercise, they have a higher incidence of colon cancer. So yes, we do have a list of things. And those are all things that we consider in a patient when we're talking about their risks and we're considering what procedures we need to do on them.
Okay. All right, so now we have a situation where, as I mentioned about this lady who came up and said, thank God you have these shows, because my husband didn't want to go, and say, listen, what's that doctor saying? And I'm hoping that from the result of this show, we get people to get colonoscopies or at least start a process of doing that. When we are looking at, let's assume you find a cancer, okay? God forbid you find a cancer. What are the survival rates? I mean, what are the percentages here?
Yeah. Well, it's colon cancer is staged 1 through 4, or actually 0 through 4. If we find a colon cancer stage 0, 1, or 2, that means it hasn't spread through the wall of the colon. You have a 90% chance of surviving 5 years. Okay. Right. If it has spread through the wall of the colon and got into the lymph glands, you have a 70% chance of surviving 5 years. If that cancer has spread to a distant organ, the liver, the lungs, the brain, the bones, you have about a 15% chance of surviving 5 years. So the sooner we find it, it's curable.
Yeah.
It really is.
The happier we are.
Yes.
Yeah.
Now, and those numbers are with surgical treatment. Now there's adjuvant and other treatments.
lots of treatments.
So it's not, that's just based on the surgery.
Correct.
Not in modern oncology, okay, it's gone through the wall, my goose is cooked. No, there is still, there's the oncologist, the cancer doctor can offer all different kind of what we call either palliative or adjuvant therapy. Adjuvant therapy means I don't see the cancer, the surgeon says he's got it, but if there's a couple of cells left, I'm going to treat them as if they're there, and I could lower that risk even more. So we don't just stop with the surgery, unless, as I said, if it's right in the wall, sometimes the oncologist says, you're done. We don't need to treat you anymore. You're finished. That's it.
This is a team approach.
Yeah.
Family doctor starts it, we step in and do our part, then it's oncology, radiation therapy, surgery. We work as a team and discuss this, what is the best treatment once we find it.
I realize that it's hard for a doctor to say you got it, because you can't, you may have suspicion, so you say let's wait to see what happens, and of course everything's.
I never tell a patient that they have it until I see the pathology.
Is that right?
Yes,
Yeah.
absolutely.
That's the gold standard.
Yes.
But you can say everything looked good.
Oh, yeah. If it's normal, it's normal.
Or
Yeah.
a lot of times if it's a little polyp, I said, yes, we still want to see the pathology report, but the chance of it is so low.
Correct.
So,
Take the stress off them.
Yeah.
All right, so you're in a new location at the Hazleton Well. Folks, the number to call, very simple. Please get a colonoscopy. Please get some screening checks. Its prevention is fantastic. Believe me, if I could do it, anyone in this entire world could do it. 888-402-LVHN. And you could, it's at the center there, they're prepared. God forbid something should happen, but so far we've been doing okay, right?
Yes.
It's nice to see the both of you.
Thank you so much for doing this and educating
Appreciate
the
it.
public. We can talk to people,
Yeah.
but we really appreciate your input.
And I find, the people that watch the show, okay, and they're like me, they're afraid to go to the doctor. They're afraid of what if they, and here's the thing, what if they find something? God, I mean, how many times have you heard that? If there's something there, you want them to find it, okay, or her. And I got to tell you, I've been supporter since 1994 of the Hazleton area doctors and nurses, etc. I used to hear, well, we got to go out of town, but let me tell you, we have great guys like you, okay, women who are out there who they're bringing in. We're very, very happy to have the both of you on board. Stick around, Ed, for at least another 10 more years, okay? And Bob, stick around a
I
little bit.
need the vitamins you're taking.
Yeah. Remember, folks, 24/7 ssptv.com. Do not be afraid. Please get a screening done. It can save your life. We'll see you next time.